Welcome to Welingkar Institute of Management, Mumbai, where we break down the real world business transformation. I am Shraddha.
Hi, and I'm Pallavi. Today's topic is one that literally saves lives: healthcare operations, specifically how Apollo hospitals tackled inconsistency across its vast network.
If you ever thought hospitals in India are unpredictable, you are not alone. Let's explore what's going on wrong and how Apollo built a model that others can learn from.
India's healthcare sector is booming in metros, but are broken in many other parts. There's lack of doctors, inconsistent healthcare protocols, and huge gaps between private and public hospitals.
Even within private chains, like hospitals in same network, patients sometimes receive totally different treatments for the same issue.
And that's not just confusing, it's dangerous because in healthcare, inconsistency can actually lead to death.
The Apollo Hospital, founded in 1983 by Dr. Pratap C. Reddy, became a pioneer in India's private healthcare revolution. But with success came a new problem.
They grew fast and to 70 plus hospitals across India, but each unit ran differently. A bypass surgery in Chennai looked different than in Hyderabad. Clinical practices varied. The procurement was decentralized.
Patients were affected, and not from a business lens. It created inefficiencies, cost overruns, and trust issues.
This was a classic operational breakdown, what consultants would call it a standardization crisis.
To fix it, Apollo didn't just hire more staff or build more tech. They transferred their entire operating model through something called ACE program, Apollo Clinical Excellence.
And it had four pillars. First was the evidence based clinical pathways, so every doctor followed the same best practices and treatment steps. Number two was standard operating procedures, SOPs. They documented everything from admission to surgery to discharge. And number three was centralized EMR, electronic medical records, accessible across all hospitals of Apollo. Number four was Med Skills, a training system for not just doctors but also nurses and admin staff.
But they also went deeper. They applied to powerful management framework, TQM and Lean Six Sigma, to ensure this solution works smoothly.
Now let's decode TQM and Lean Six Sigma that were used by Apollo. TQM refers to Total Quality Management, and it is about building a culture and continuous improvement. At Apollo, it meant everyone, not just doctors, were trained to identify errors, suggest fixes, and prioritize patient safety.
So, second was Lean Six Sigma. On the other hand, combines two things. Lean means cut waste like duplicate test, waiting time or unused equipments, and Six Sigma means reduce defects. For Apollo, this means fewer surgical complications, lower readmission rates, and faster discharge processes.
Together, TQM and Lean Six Sigma helped Apollo streamline care without sacrificing their quality. It was about doing more, and it was about doing it better. And now, the results that were powerful: patient outcomes improved, admission to discharge time fell short, and procurement savings rose thanks to the centralizations. And importantly, care became consistent across the country. Apollo now had a model that worked in Tier 1 cities, Tier 2 towns, and Tier 3 markets that was scalable, sustainable, and safe.
So, what's the imbalance here? First, standardization doesn't kill creativity, it enables scale. Second, healthcare consulting is more than finance, it's about operational systems and culture. Third, frameworks like TQM and Lean Six Sigma are not just theory, they are transformational tools.
And Apollo succeeded not just by fixing processes, but by aligning people, systems, and data. From chaos to care, Apollo's journey shows how structured thinking can solve even the most human of challenges. Thanks for tuning in. If you like this breakdown, share it with your friends and hit us a like. Follow us for more case based learning.
Thank you.
you.